My question is to the Minister of Health and Long-Term Care. Speaker, last week was Family Doctors Week, and many family doctors are quite concerned about patients' access to timely health care services. Over 800,000 Ontarians are currently without a family doctor, and these patients are unable to have their health care needs met appropriately. Ontario is blessed with dedicated and selfless family doctors, but they are facing an uphill battle. The resources are tapped, and they face a growing burden of an aging population requiring complex care, while an additional 140,000 patients enter the health care system each year. As a result, less than half of Ontarians are able to see their primary care provider within 24 hours of getting sick. Minister, family doctors are wondering why the government's response has been to cut $800 million from physician services, stop collaborating with OMA, and, as reported by the media, threaten to cut doctors' pay. Mr. Speaker, will the minister explain why he targets and blames doctors for his government's failures?
Well, thank you, Mr. Speaker. I'm proud of the work that our frontline healthcare workers, including our doctors, are doing. But I have to correct the member opposite. We have been discussing with the OMA on a regular basis. I met with the President just a few weeks ago as well. We're prepared to re-enter discussions leading towards an agreement at any time. It's the OMA that, in fact, has refused to come back to the table to continue those negotiations. But I remain optimistic. I remain optimistic, Mr. Speaker, because the OMA did agree to co-establish with us a table that looks at the future of physician services in this province, Mr. Speaker, to look at issues of compensation, to look at human resource issues, to look at important issues like what Health Quality Ontario released in the report last week in terms of wait times for Ontarians, the sorts of issues which will give confidence to our physicians that we are working together in partnership for a sustainable health care system.
Thank you. Supplementary.
Thank you, Mr. Speaker. Speaker, back to the minister. Minister, the relationship between doctors and the government is at an all-time low. This government has twice imposed fee reductions and limited options for practicing family doctors. Patients are the ones who are suffering. To build a sustainable health care system, this government must collaborate with frontline health care workers. Instead, we see this government scold doctors in the media, cut resources for patient care, and chase away medical residents and students to other jurisdictions. Mr. Speaker, can the minister explain to me how blaming and penalizing doctors is helpful to patient care?
Thank you.
Well, Mr. Speaker, I quite frankly don't know where to begin. There's so many problems with what the member opposite has just presented here. First of all, in terms of his allegation of cuts, we're increasing the budget that goes specifically to physician compensation by 1.25% last year, this year, and next year as well. There are no cuts. In fact, we're increasing, and we're increasing to accommodate the changes in demographics and the growth in our population, Mr. Speaker. But I want to remain optimistic. I've reached out to the OMA, despite what the member opposite and his position might be and the position of the opposition party. I've reached out to the OMA. I want to engage them. We're always open to continue discussions and negotiations, despite a year of negotiations. The OMA, at this moment in time, has refrained from restarting those discussions with us, but I'm optimistic that those discussions will one day bear fruit.